Hello, this is Carol Meredith, Executive Director of the ARC of Arapahoe and Douglas, and we're making this video today to help you understand Colorado's Medicaid waivers and the long-term care system in Colorado. So the first thing that people need to understand is that Medicaid and long-term care and all of that is a part of the healthcare system. And the healthcare system is really complicated. So we want you to remember that there's private insurance, there's Medicare and Medicare Advantage plans, there's Medicaid, which in Colorado is called Health First Colorado, and that's a public insurance program for poor people and folks with disabilities. And then on top of that, under Medicaid, there are things called waiver services. And they're separate pieces of the whole healthcare system. So today we're going to be talking about Medicaid, because Medicaid provides long-term care services and supports. And really no other health insurance product will provide long-term services and supports so that people can live in the community. It's important to know Medicare does not provide long-term care services, only Medicaid. So if you look at this next slide, Medicaid provides what we call state plan. And that's the agreement that we made with the federal government as to what medical services we are going to provide under Medicaid in Colorado. Long-term care is a part of those medical services in Colorado. And long-term care is usually thought of as nursing homes, IDD institutions, which we think of also as the regional centers. If you've lived here a long time, you'll know that those were Ridge, Pueblo, and Grand Junction, and home health. So the highest level of care under long-term care is nursing homes, ICF MRs or ICF IDD, regional centers, and home health. And then there are things called waiver services. Now, these are called HCBS waivers, and HCBS stands for Home and Community-Based Services. They're not in the state plan. These are extra services and supports that are offered to certain people who qualify for them, and they're all about staying in the home and in the community. So it's not about being in a nursing home or an institution. It's about being in the community. So what supports and services do you need to live in the community? So like I said, we're home and community-based waivers, HCBS. You'll hear HCBS talked about a lot. And Colorado has more waivers than any other state. We really went bonkers creating Medicaid waivers. So that's one of the reasons for this video, to help you understand all the different Medicaid waivers that are available in Colorado. We have 10 waivers currently. This is July of 2018. 4 of those waivers are for children, and 6 are for adults. So let's look at the Colorado children's waivers. Now, it looks like there's 5 on this slide, but I have crossed off the Children with Autism waiver because as of July 1st, 2018, that waiver is no longer in existence, and I will explain that later. So the first waiver I want to talk about is the Children's HCBS waiver. The Children's Extensive Support waiver will come next. Then we'll go over the Children with Autism waiver just a little bit to help you understand the system. Then there's Children with Life-Limiting Illness waiver, and what we call the CHIRP waiver, which is the Children's Habilitation Residential Program waiver. These are the adult waivers: supportive living services, or SLS, brain injury, or BI waiver, elderly, blind, and disabled, that's referred to as the EBD waiver. We love our acronyms. HCBS DD, which is a comprehensive residential waiver. It's also referred to as the comp or the residential waiver, the spinal cord injury waiver, and the mental health waiver. Okay. I am happy to report to you that at this time, the only waiting list we have for these waivers is for the HCBS DD adult residential waiver. So we've been able to get rid of all the waiting lists for all the other waivers. This is a huge accomplishment that Colorado should be very proud of. Now, each waiver has different, and these are important categories for you to understand: eligibility, entry point, waiver services, service provider qualifications, and waiting lists. So eligibility. The person with a disability, first of all, must meet the financial eligibility, or if it's a family with children, the parent must be determined over income or Medicaid sometimes. So the parents, if they're under income and can access Medicaid, they can also get access to the children's waivers, most of them, not all of them. But for an adult with a disability or who is elderly or blind, they must meet the financial eligibility criteria. So you have to be poor. The next one is that you have to be eligible for long-term care. And the key word here is functional. And functional means you can't do basic activities. They also call them activities of daily living and instrumental activities of daily living. And these are things like taking a shower, eating, brushing your teeth, basic sort of hygiene things on the ADLs, the activities of daily living. Being able to move around by yourself without assistance. Those are some of those criteria. You can't, if you're functional in all of those kinds of things, you're not going to be eligible. Now, on the intellectual and developmental disability side, there's also, and actually the elderly, as they go into dementia kinds of diseases, you'll see that there's also these instrumental activities of daily living. And those are things like, I know this sounds silly in 2018, but it's actually listed this way: using a phone book, calling people to make medical appointments, being able to schedule your day, managing your money. Those are those kinds of those. If you have deficits in those things, those will let you be eligible for long-term care. Then you also must meet the level of care for that particular waiver. And that's hospital, nursing home, or intellectual and developmental disability, ICF, intermediate care facility, level of care. And then, because we have so many waivers, we have something called other. And so the other categories are intellectual and developmental disability, mental health, or life limited. Those are sort of the other eligibility criteria for that particular waiver. Okay, so I wanted to go quickly through EPSDT, which stands for Early Periodic Screening, Diagnosis, and Treatment. This is only for kids, and it's only under Medicaid. And so what happens is that states, and Colorado did choose to do this, they make a deal with the federal government saying, we're going to provide all medically necessary services for children birth to age 21, not 18, 21, that are medically necessary as determined by a doctor. Now, the T in EPSDT for treatment, that can be a really strong advocacy tool for children with disabilities. So it's important that you know about this. It doesn't work for experimental therapies. So, if you read about something on the internet and you want to try that and you want a doctor to say that it's medically necessary, the doctor might say that this is medically necessary, but that doesn't mean particularly that Medicaid is going to provide funding for you to get that treatment or your child to get that treatment. So it's not everything, but it's a really good tool to know about for children. Okay, so let's go through those children's waivers. We have the Children's HCBS waiver, the Children's Home and Community-Based Services waiver. Okay, so eligibility for this waiver is that you must have a significant disability, the child, and the parents must be over income for Medicaid. Okay? Also, the child must be medically fragile. Now, a doctor determines if someone's medically fragile or not, and it's important for us to advocate clearly with medical professionals to help them understand that terminology. The entry point, this is where you start. If you want to get this waiver, you would go to a single entry point or a community-centered board. Not all community center boards will do eligibility for the Children's HCBS waiver. Some of them do, some of them don't. So this is one of those things that we're not consistent with in Colorado. The services under this waiver are only case management, IHSS, which stands for In-Home Support Services. I'm going to talk about that later, and access to Medicaid state plans. This waiver was started during President Reagan's term, and it used to be called the Katie Beckett waiver, because what happened was Katie Beckett lived in a hospital because she had a significant disability. She was born prematurely, all those kinds of things. The parents wanted to take her home, but they needed extra services and supports to be able to take her home and take care of her. So they went to their powers that be, the federal government and the state government, and said, we need a waiver that will allow us to keep our child at home because it's going to be cheaper than keeping her in a hospital, and it's going to be better for her. She gets to have a life. So that's how this waiver began. Now, the service provider qualifications basically are that any medical providers that you have for your child, you want to make sure that they take Medicaid before you go to the trouble of getting your child on this waiver if you want to keep that provider. Medical providers in Colorado do not have to accept Medicaid. Many of them do, many of them don't. So that's an important thing for you to remember. All right, the Children's Extensive Support waiver. Okay, for eligibility, the child must have a developmental disability as defined in Colorado. So that's an important piece on the eligibility. That's one of those other categories that we talked about. Parents' income can be over income for Medicaid, or it can be under income for Medicaid. It doesn't matter for this particular waiver, because the parents' income is going to be waived if they're over, and if they're under, you would have access to Medicaid, plus these extra supports and services that are available under this waiver. It's a tough waiver to get into because the child must require intervention from parents throughout the night as well as throughout the day. So if your child sleeps through the night, all night, you're not going to be eligible for this waiver, and that's important to know before you go in there. The entry point for this waiver is the community-centered board. They do the eligibility for all services for people with developmental disabilities. But look at these services. These are the services that are provided under this waiver. Personal care, which is like hygiene, dressing, bathing, eating, those kinds of things. Housekeeping can be a really nice thing to have somebody come in and clean your house if your kid happens to be incredibly messy, or maybe they have, you know, a medical condition that requires the environment to be exceptionally clean all the time. Community connector, which is someone who can take the child out into the community and connect them. We often see people going to Boy Scouts or Girl Scouts or swim team or something like that, and they have somebody there to assist them to be connected in the community. Respite, which is care for the individual with a disability, the child with a disability. So the caregivers, and the parents mostly in this scenario, can take a break. Behavioral services are no longer available under this waiver because they are now available under the state plan. But I've kept it in this presentation because I wanted you to know that they used to be available under this waiver. Specialized medical equipment and supplies. These are things like wipes and chucks and stuff like that where you know, kids with incredible physical disabilities. Some of that, a lot of that is covered by state plan Medicaid, but some of it is not. You can pick that up under this waiver. And home modification, a big service for people that need to get ramps built so that their child with a wheelchair can go in and out. Sometimes you need to make the doorways wider, those kinds of things. There are caps and limits on home modification, but it can be a real help for families because that's a very expensive thing to try to do on your own. We're going to make sure that you have access to the service provider qualifications, but it's important to know that those are detailed in each one of these 10 different waivers, and they're all different. So if you have somebody next door to you who you think might be able to help you with respite or whatever for your child, you need to know and understand what those service provider qualifications are. It's a very rich waiver. You can access a lot of services under this waiver, but you can't get it, again, unless your child doesn't sleep through the night and requires intervention throughout the day and night. So this is the Children with Autism waiver. So this explanation is going to help you see how the system works. So the reason that the Children with Autism waiver is going away, or has gone away as of this date, July 2018, is because the only services, as you'll see under waiver services, that this waiver offered were behavioral. Now, in November of 2016, that's pretty close, the Centers for Medicaid and Medicare, which is a federal agency, they said, look, Colorado, you have to provide behavioral services for kids under your state plan EPSDT protections. So any child now who who a doctor says requires behavioral services because they're medically necessary, remember, they can get those on Medicaid. They don't have to be on a waiver. So that's why we had to take those behavioral services out of the waiver services, because if it's provided in the state plan, you can't provide it in a waiver. Also a good thing to know. Okay, children with life-limiting illness. The child must have a life-limiting illness as determined by a doctor. This is a hard one for families to go after, and we understand that. But Colorado decided that it was important for these families to have the services and supports that they needed to be able to keep their child at home when they had a life-limiting illness. You may think of it being the worst case scenario, but some doctors really believe that intractable epilepsy, seizure kinds of things are life-limiting illnesses. So I wouldn't just take it off your list. It might be something that you could access. Okay, so this is the Children's Habilitation Residential Program, or the CHIRP waiver. The most important piece of this slide for you to think about is that in 2018, the legislature, so this is the last bullet on this slide, the legislature authorized healthcare policy and financing, the state Medicaid agency, to change this waiver. And the best part about it is they changed a lot of the things that are going to change a lot of the things that made eligibility really awful. So when you look at eligibility, you can see that the child must have a developmental disability, ages birth to 21, and that the child is placed through the County Department of Human Services. We thought it was really unfair that parents who had children who were extremely difficult and dangerous to care for, who really needed a lot of supports and services, have to go through the County Department of Human Services and have a dependency and neglect hearing in order to access those services. So that's going to go away. That criteria that a child, that the parents have to be determined neglectful for the child to be able to access those services. So the entry point is going to change. It hasn't changed as of today, but it will change as soon as we get through this process of changing the waiver. The entry point right now is the County Department of Human Services. So that would be like the Arapahoe Department of Human Services, Douglas Department of Human Services. In the future, it will become the Community Center Board because, again, for eligibility, this child has a developmental disability in order to access this waiver. The waiver services you see listed there, they're going to change some. The most important services we're going to be adding to it is a transitional service. So what do we want to make sure is that for a child who is at risk of out-of-home placement, gets absolutely all the services they need to get in the home before they have to go into an out-of-home placement. And then we want to make sure after they've been in an out-of-home placement and hopefully stabilized, learned some skills, gotten some of their behaviors under control, that there are transitional services to assist the family to take the child back and ensure that they've got all the skills and the support that they need to be able to keep the child in the home safely. So again, the service provider qualifications are defined in the waiver, and those are going to change. But we're really excited about this change. So this is good news. All right. So now we move on to the adult waivers. The first one we're going to talk about is supported living services, or SLS. You'll hear it referred to as SLS a lot. Okay, so eligibility. Adult over the age of 18, and they must have a developmental disability as defined by the state. They must be eligible for long-term care, activities of daily living. Remember when we talked about that? So that's those eating, bathing, dressing, being able to make doctor's appointments, thinking your way through your day, those kinds of things. And they must not need 24-hour care because either they have parents or family members who can take care of them the rest of the time, or they're fairly high functioning and they just need a little bit of support to make sure that they can get through their day and live in the community. The entry point is the Community Center Board, and the waiver services are listed there. They look, you'll see that these look a lot the same as you go through the waivers, but they're not exactly defined the same. And the service provider qualifications are not always the same. We're working on that, but we're not there yet. So, personal assistant, which is like personal care. So it's eating, bathing, dressing. Housekeeping, we talked about, somebody clean the house. Community connector, we talked about. Respite, we've talked about. Behavioral in this waiver is going away for people aged 18 to 21. Because remember that EPSDT thing that we talked about? And those services, behavioral services, are available to people up to the age of 21 in the state plan or under EPSDT. But for people over the age of 18 who need behavioral services, they will be able to get those under the waiver. Specialized medical equipment and supplies, we talked about that. Home modification, we talked about that. Counseling, therapeutic kinds of services, massage, hippotherapy. Dental is now available under the state plan to anyone with Medicaid, but there is a cap on it. So if the person on this supported living services waiver needs more dental work than is available under the state plan, the waiver can then kick in. They have to get as much as they can out of the state plan because the state plan comes first in our chart. But after that, if they need more, they can get that through the waiver. Day services are what you think, you probably heard of day programs. The most important service, I think, here is employment services. It's supported employment. It can help your son or daughter or the person you care about to have a job in the community and the support that they need to keep that job. Service providers, again, are in the waiver, and there is no waiting list. There's no waiting list for this waiver. Exciting. Elderly, blind, and disabled is the next waiver, the EBD waiver. So eligibility for this is long-term care, which are those functional activities of daily living and instrumental activities of daily living. If you can do everything you need to do for yourself, all by yourself, independently, then you don't need the services on this waiver. But you have to prove that you can't do that. So you have to go through this assessment. So that's part of the eligibility. The person could be elderly, 65 plus. The person could be blind or physically disabled, and they're 18 to 64 years of age. Now, this requires a nursing facility level of care. So for people with intellectual and developmental disabilities who don't have a lot of medical conditions, maybe they don't need to use a wheelchair, maybe they don't have oxygen, maybe they don't have a G-tube or something like that, it can be hard to get eligible for this waiver. But for people with intellectual and developmental disabilities that do require those kinds of medical interventions that might put them in a nursing home, they could access this waiver. The services in this waiver look very much like SLS. They've got day programs. Alternative care facilities is an interesting piece of this waiver. It's like a residential setting. So alternative care facilities are, you see a lot of this in the elderly community where people would go into an alternative care facilities and private pay for this. And they would get meals, and they'd get somebody to manage their meds, and they'd get a place to live, and they'd get somebody to come in and help them take a bath or wash their hair or do their nails or whatever. That's what an alternative care facility is. And it's kind of like a residential facility. Most alternative care facilities have a lot of people who are elderly. So you're not going to see a lot of people with intellectual and developmental disabilities who are younger feel comfortable in an alternative care facility. Emergency response systems are like those buttons that, you know, I've fallen and I can't get up, or those kinds of things. Home modifications, again, a nice benefit. Homemaker, we know what that is. Somebody help clean. In-home support services, and I'm going to get into those. Transportation, personal care, and respite. All things we've already talked about. No waiting list for this waiver, again. Okay. This is HCBS DD waiver. That's its formal name. So it's HCBS Developmental Disabilities. That's what the DD stands for. You'll hear people call it comp waiver. You'll hear people call it the residential waiver. Let's take a look at this. Eligibility. Must qualify for long-term care through the ULTC 100.2. That's the assessment we were talking about. It's ubiquitous across all the waivers in Colorado, and that's the thing that tells you whether your activities of daily living or your instrumental activities of daily living are deficient enough that you would qualify for long-term care. And they must have a developmental disability. The entry point is the Community Center Board, or CCB. This waiver looks like it doesn't have very many services, right? Compared to the other waivers we've looked at. They have day programs, day services, supported employment, like SLS, which is good. This also has residential. Residential services in this waiver include personal care, bathing, dressing, eating, hygiene, all of those kinds of things, as well as meal preparation, med management, helping people to access their community. That's all included in the residential daily rate in this waiver. So even though it looks like it doesn't have as many services listed, it actually has a lot. It's just all under that residential. Behavioral services for people who are over the age of 21 are available under this service. And the dental vision kind of stuff that we talked about before, where you have to use a state plan, and then if you need extra, you can get it. Transportation is also covered under this waiver. The service provider qualifications are listed in the waiver, and they are unique to this service. Program approved service agencies, PASAs, are the people that you're going to go to when after you've been approved for the waiver, and these are the agencies that are actually going to provide the services for people in the HCBS DD waiver, the SLS waiver, and the CES waiver. Now, the waiting list for this waiver is long. This year, the legislature did allocate an extra 300 slots for this waiver. Hallelujah. We're very, very excited about that we got those extra dollars into that program. But there still is a waiting list. So you cannot get this service right away. You can access this waiver sometimes if you're in an emergency situation. And an emergency situation really needs to be an emergency, like you're homeless, you're abused or neglected in your current situation, and that no other waiver that we've already talked about would be able to meet your needs. But if you need help with that, call your chapter of the ARC, because we're happy to help you do that, as well as your community center board. Brain injury waiver. Again, the ULTC, the long-term care, you have to qualify for that. And you must be determined to have a brain injury. And these are listed, and a doctor has to say, yes, this person has a brain injury. Well, look at this. This is ages 16 and older. So the reason we did this is because any of you who have teenagers know that that 16 to 18 time frame is pretty darn dangerous, right? And a lot of kids, unfortunately, get brain injuries during that time period. So that's why this waiver is a little different from age categories. Entry point is a single entry point. The services are very much the same as the ones we've already described. So the day programs and the day treatment and the personal care. However, those definitions are going to look a little bit different because we just couldn't make them all the same, right? So it'd be easy. We had to make everything a little bit different. So it's important that you read those and think about those before you get there. And the qualifications for anyone who provides the services are listed in the waiver. Now, the level of care is hospital or nursing facility. And remember, we talked about that at the EBD waiver, nursing facility level of care or a hospital level of care. So it has to be somebody with a pretty significant brain injury to be able to access it. They must be eligible to go to a nursing home or live in a hospital. And there is no waiting list for this waiver. The community mental health waiver, they must qualify for the long-term care, just like we talked about. The level of care is the nursing facility, like we just talked about. So they must have a mental illness that's so severe that they would be eligible to live in a nursing home. And they must be determined to have a major mental illness. And these diagnostic codes are actually listed in the waiver application or a reference to them. So it's only for certain people with mental illness, not all people with mental illness. It has almost the exact same services as the EBD waiver, but it has that alternative care facility piece, which is kind of like residential, right? That's a place where people can live. The entry point is the single entry point. Again, read those service provider qualifications, and there is no waiting list. Now, the spinal cord waiver, it's also called the spinal cord injury waiver. This started out as a pilot program because people with spinal cord injuries said, look, we need to have a waiver that provides different services than the other waivers that we've already talked about, which are pretty much the same, right? So in order to be able to access this, you have to pass the functional eligibility, or fail the functional eligibility test, the ULTC 100.2, and you must have a spinal cord injury. So a doctor has to say you have a spinal cord injury. It's currently only available in Adams, Arapahoe, Denver, Douglas, and Jefferson counties. Go to the single entry point to access it. Now, it's almost the exact same services as we talked about in the EBD waiver, except for it also has alternative therapy. Because those people with spinal cord injuries, they came in and advocated for this waiver because they said, look, massage really, really helps me more than you can believe. It's much better than anything else. Acupuncture really helps me. Yoga and mindfulness kinds of training really, really help me. We need to determine if these are important services for this pilot. There is no waiting list for this waiver, and it's a nice waiver. So that was a lot, right? 10 different waivers. But you have to remember, a lot of the services under those waivers are similar. The key is the eligibility. Do they meet the level of care, nursing home, hospital, intellectual or developmental disability? Do they have the right diagnosis? Do they have a brain injury? Do they have a mental health disorder? Do they have a spinal cord injury? Those are the things that are going to make you go down a different path than someone else because of who you are or who your child is. I wanted to spend just a minute talking with you about consumer-directed attendance support and services, CDAS we call it. This is not a waiver, so it's not listed under the 10 different Colorado waivers. But what this is a service delivery model that is different from the other ways that we deliver services in Colorado. And it's very much what it sounds like. The consumer, so the person with the disability who's eligible for the waiver, and or their authorized representative, who could be a parent or a friend or a neighbor or a brother or a sister or whoever, that authorized representative. But they direct the services. What happens is that for the waivers where CDOS is available, and it's available in a lot of them. So it's EBD, CDOS, spinal cord injury, it's mental health, it's not mental health, it's brain injury. It's available in a lot of the different waivers. Soon to be available under SLS, the Supported Living Services. It's very different because the clients, so the people with a disability and or their authorized rep, they're going to hire, fire, train, supervise attendants. They're going to set wages. They're going to manage budgets. And a budget will be created for people who use CDOS so they'll know exactly how much money they have to spend over the year to provide those services. You can hire family members. You can hire unskilled attendants that can provide skilled care. So it gets a little complicated, but CDOT waives the Nurse Practice Act. So if you have a G-tube or oxygen or a catheter or something like that, that usually requires an RN or a certified nurse's aide or somebody like that with a license to provide the care. Under CDOS, you can hire your neighbor to do that. And you can say, hey, look, I know how to change my catheter. I can't do it because I'm not physically able to do that myself. But I'm going to train you exactly how I want that done. All right? You can do that under CDOT. And that neighbor does not have to be licensed. It's an important service delivery model for you to think about if you'd like to control your own life. Some people don't, and some people do. And for the people that do, they really, really like it. Now, in-home support services is another kind of service delivery model. It's available not under all the waivers, but some waivers. Like the children's HCBS waiver, it's available under that waiver. And what happens here is it's a partnership between the agency and the client and or their family. They develop a care plan, the client then chooses the agencies and the attendants. Again, the family members and spouses can be attendants, which is nice sometimes. And it's a way it really works well in the rural communities, as you can imagine, because you can't get licensed people to come in. So you really do need to hire your neighbors and your friends and those kinds of people. And so in-home support services can be a lifesaver, but you're partnering with an agency. You're not hiring, firing, training, and managing a budget all by yourself. You've got an agency that's helping you do that. But again, it waives that nurse practice act. You know this is complicated. It's a lot. But for people we've done this presentation for, it's helpful for them to understand the long-term care system in Colorado. And we hope it's helpful for you. And please contact me, and I've given you my email and our website. If there's anything we can do to clarify this or help you to understand things more, we're here for you. There's also a couple of links to the different waiver charts within the waivers, and those links on the Medicaid website, the Health Care Policy and Financing website, will help you see the different waivers and how they've changed. One for kids and one for adults. And then we also, a group of advocates and people from the state and agencies came together and created these choosing a waiver document. So I provided links for those to you so you can see if you wanted to choose a different waiver, because there's 10 of them, right? You got to figure this out. These charts will help you do that. Thanks so much for your attention. Hope this is helpful. Please stay in touch with us. Take care.